Sometimes get abdominal pain, constipation, and diarrhea. And do you usually wonder, what am I having? Is this cancer? And then you've been to the doctor, and the doctor said, oh, you have irritable bowel syndrome or inflammatory bowel disease. But what are these diseases? Do you want to know what's going on in your body and if you're at risk for cancer? Then you have come to the right place. Welcome to Get Healthy with Dr. Cooper. This show is designed to educate you on how to live a happier and healthy life using simple lifestyle modification. My name is Dr. Cooper Dockery. I'm board certified in internal medicine, and I want to welcome you again to Get Healthy with Dr. Cooper.
Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
Welcome back to Get Healthy with Dr. Cooper. On the show today, we are discussing bowel problem, whether it's irritable bowel syndrome or inflammatory bowel disease. I know these are big words and you're wondering, what is she talking about? But you know what? I have the expert in my show today, and he's going to break it down to you. Dr. Samir, welcome to Get Healthy, Dr. Cooper.
Hi, how are you, Dr. Cooper?
I am doing well. Welcome to my show.
Thank you. Thanks for having me here.
It's a pleasure, Doctor. Dr. Samir, you have been a gastroenterologist for how many years?
I have been a gastroenterologist for past 20 years.
And what does that mean, gastroenterologist? What do you really do?
Well, as the name suggests, I take care of all the digestive diseases, including liver disorders, pancreatic disorders, issues with the esophagus, like heartburns, GERD, gastroesophageal reflux disease, issues with colon, like ulcerative colitis, inflammatory bowel disease.
Oh, those are long names.
Colon cancer, and all those disorders.
So everything from the mouth to the rectum, right?
To the rectum, yes.
Fantastic.
Yes.
Now, where do you currently work?
I work at Renaissance Gastroenterology clinic, and I've been there for several years, and we have a group of GI physicians, and I mainly practice there.
Good, good, good. So you live in South Texas, correct?
Yes, I live in South Texas for past 20 years.
I hear an accent. Where are you from?
I'm from, originally I'm from Pakistan, and I have my training in New York, where I did my residency as well as my fellowship, and I'm board certified in internal medicine, which I keep it still until now, though I practice GI.
Smart guy.
But I keep my internal medicine, and I'm a board certified gastroenterologist as
Very
well.
good.
Yes.
And I know you're a fantastic doctor because I refer a lot of my patients to you.
Well, thanks for your confidence on me.
Right, my patients are very happy.
Thank you.
So today we want to talk about two diseases that people usually confuse.
Yes.
Irritable bowel and inflammatory bowel disease. How common are these diseases?
Actually, irritable bowel disease is more common, or irritable bowel syndrome is more commoner than inflammatory bowel disease, but the name is quite similar. That's why people get confused. However, they're very distinct and different diseases with different symptoms and different treatments. So basically, they're entirely different diseases.
Alrighty, I want you to spend some time a little bit on the lesser of the two, and that is the
IBS.
IBS.
Irritable bowel syndrome. Yes.
Right.
Well, IBS one thing to remember about IBS that it is a chronic disease, and it's an annoying chronic disease. However, it does not affect the longevity of a patient. So this is a very important point to understand, meaning that it is benign condition in a way that it does not lead to any kind of cancer. Yes, it is an annoying disease. And the basic pathology regarding irritable bowel syndrome is the fact that there is a GI gut or gut-brain axis. So what happens is that anything that happens in the GI tract, the brain perceives it in an exaggerated manner. So supposing if somebody has a small amount of gas, the patients with the IBS will perceive it in an exaggerated manner rather than a normal person, which will say, well, I don't feel anything. So it's a variety of, it has different symptoms, which may include abdominal pain, that is associated with defecation, and also change in bowel habits like constipation, diarrhea. So that's why we divide irritable bowel syndrome into two: IBS with predominant diarrhea and IBS with predominant constipation.
That's right. Yeah. So sometimes I'll tell my patient that the irritable bowel syndrome is controlled by the brain. Patients who are anxious and nervous, they're the ones that usually present with irritable bowel syndrome, whether it's colicky pain or whether it's just constipation or whether it's diarrhea. Sometimes somebody will say, I'm so nervous because I have an interview and I kept going to the bathroom. That is a part of this same syndrome, am I not right?
Yes, you are absolutely right. That this is, as I mentioned earlier, that this is regarding exaggerated response of the brain towards any stimuli or any kind of injury or any kind of that is happening in the small intestine or large intestine. Brain perceives it in an exaggerated manner. So
Very
that's
good.
what it is.
Excellent. You know what? Before we come back and discuss the inflammatory bowel disease.
Yes.
We're going to take a short break and we'll be right back. So don't go away. I'll be right back.
Are you tired of being sick and tired and ready to take back control of your health? If so, Dr. Donna Cooper and her team are ready to help. To order her books or the DVD series Get Healthy for Life and 14 Days to Amazing Health, call 1-844-343-8935 or go to drdonnacooper.com today. Dr. Donna Cooper invites you to connect with us. Like us and share our social media networks. You can watch repeat programs of our shows anytime on Vimeo. Find us on our website at drdonnacooper.com.
Welcome back to Get Healthy with Dr. Cooper. Before the break, we were discussing irritable bowel syndrome. I think the sister of inflammatory bowel disease. And I have Dr. Samir here, a board-certified gastroenterologist that works in South Texas. He's going to be discussing now inflammatory bowel disease, and then we're going to walk over there and continue to speak.
Great.
All right, so Doc, tell us a little bit about IBD.
Okay. Before I go to IBD, since we were discussing IBS, which is irritable bowel syndrome, I would like to tell you a few things about the clinical manifestations, how they're different.
Okay.
IBS, you're not going to see any bleeding. Bleeding is not an important feature of IBS. Mainly recurrent abdominal pain associated with defecation and change in bowel habits, meaning sometimes constipation, diarrhea, or combination of the two. However, in inflammatory bowel disease, things are very different.
Right.
Their major manifestation is abdominal pain with bloody diarrhea, weight loss, and abdominal pain. So it is different. It does have different manifestations as well,
That's
clinical
right.
manifestations.
That's right. And when a patient sees blood in the stool, that's a big alert that something is happening. Why don't we walk over there? We're going to continue
Sure.
to speak. Let's walk this way, Doc.
Sure.
All right, so we have a couple of slides, and Dr. Samir is going to go over them. So the broad topic is IBS, and then we're going to discuss IBD. So let's go to the first slide. I think we're going to discuss probably etiology. Okay, the normal colon. Let's talk a little bit about here, Doc.
Yeah, well, I mean, this is the anatomy about the colon, and as you can see in this slide, this is the appendix, which basically enters into this area of the colon. We call it as cecum. This is the ascending colon. This area is the hepatic flexure because the liver is right next to it. This is, as you can see, is a transverse colon. And this area, we can call it as a splenic flexure because the spleen is right there. This area up to here is called descending colon, and this S-shaped area is sigmoid, and this is the rectal area, and anal canal is right there.
Very good, very good. So then let's look at the next slide and see what we find there. Maybe we're going to look at, so here we have various pictures. Now, Doc, you can see here that we have various factors that can lead to these diseases. All right? So if you can tell us a few things there, the risk factors.
Yeah. Actually, with the IBS, important thing is that these are not the etiology like stress or lack of sleep would not cause IBS, irritable bowel syndrome, but it is going to make symptoms worse.
That's right.
So this is an important distinction. And as I said, that there is no obvious etiology that is known to us. There is a condition, what we call as post-infectious diarrhea, that after patients who has gastroenteritis or infection in the colon, they can develop IBS. So IBS, we don't know that who can develop it and what is the exact etiology. Yes, but there are certain factors that will influence it, and it can cause the exacerbation of IBS.
Very good, very good. I just want to mention that lack of sleep and certain food and alcohol or smoking can increase the risk for just about any disease. And that's why we have it here.
Yes.
And of course, genetics, that's
Yes.
also a risk factor. Certain diseases are seen more in the family tree.
Yes,
All right.
and I would like to add one more point here, that celiac disease. You know, when somebody has irritable bowel syndrome with predominant diarrhea, celiac disease is one thing that really needs to be ruled out.
And what is celiac disease?
Okay, celiac disease is a disease of malabsorption, and what happens is that the intestine is sensitive to gluten. So what happens is that because of the sensitivity, there is an inflammation in the small intestine, and it will not absorb nutrients. So patient gets diarrhea, they get deficiency of vitamin D, they can get iron deficiency anemia, and sometimes they can even get liver function abnormalities with celiac. Yeah.
I'm very happy you mentioned that disease, because the entire world is trying not to eat gluten, but not everyone has celiac disease.
Yes.
So there's no need to avoid gluten if you were never diagnosed with celiac disease. All right, let's go to the next slide. I think it's very important. All righty. So now, doctor, you can tell us the differences between the IBS and Crohn's disease, which is an IBD disease.
Yes. Actually, inflammatory bowel disease includes two major diseases. One is called Crohn's disease, and the other one is called ulcerative colitis. Here in the valley, we see more ulcerative colitis than Crohn's disease. And so I'm going to tell you the difference between IBS and inflammatory bowel disease.
Excellent.
As I mentioned earlier, that in the irritable bowel syndrome, the symptoms of recurrent abdominal pain, and then it can be associated with some defecation and also change in the bowel habits, which will include diarrhea or constipation or the combination of both. We don't see bleeding there, we don't see fever there, we usually don't see any weight loss. So this is the typical symptoms of the IBS, and as I mentioned earlier, that it is not associated with long-term consequences, meaning it will not cause any cancer or anything like that. However, the condition is very different with IBS, which will include both Crohn's and ulcerative colitis. The symptoms are diarrhea, abdominal pain, bleeding, fever, weight loss, and especially with Crohn's disease, like it is a little bit different from ulcerative colitis in the presentation, that Crohn's can present with intestinal obstruction and sometimes the fistulas. Ulcerations in the mouth. And Crohn's can affect any part of the GI tract, as Dr. Cooper just mentioned, that it can involve any part of the GI tract, including mouth, all the way to the rectum. Whereas ulcerative colitis is solely a disease of the colon.
Very good, very good. I think we have some slides that you've done.
Yes.
Examine your patients. Let's go to the next slide so he can describe what the colon would be in these diseases.
Yeah, I mean, this is a picture that we have taken from patients with ulcerative colitis. As you can see here, that there is a diffuse involvement, inflammation of the colon. So in ulcerative colitis, there is diffuse involvement of the mucosa. There is no escape areas, whereas in Crohn's disease, there will be escape areas of inflammation followed by normal intervening mucosa, whereas this is not the case with ulcerative colitis.
So the inflammation is seen by the redness, right?
Yes, yes.
So when we say all of this here, it's red?
Red and swollen, and some ulceration there too.
Very good.
Yeah.
All right, excellent. Do we have another slide on this disease? Let's see if we have another slide.
This is the Crohn's disease.
All right.
So as I said, that Crohn's disease, you can see areas of some normal intervening mucosa. Here the mucosa looks relatively normal. Here it looks normal, and here you see ulceration, a lot of inflammation, and this few areas of intervening normal mucosa. So this is a typical finding with Crohn's disease. And as I said earlier, that Crohn's disease is also different from ulcerative colitis in a way that it can cause narrowing or obstruction. And here, as you can see, the lumen is almost closed. It's like very stenosed area, a small opening there. This does not happen with ulcerative colitis. It happens only with Crohn's disease, and as you can see, there is like a narrowing there. It's almost getting closed, so that will lead to obstruction.
Yeah. So if you're watching us and you're having abdominal pain and diarrhea, blood in your stool, then you need to see someone like Dr. Samir. But go to your regular primary care doctor, and the doctor will guide you where to go. Dr. Samir, I thank you so much for being on the show.
You're welcome. Thank you so much.
You stay right there. We'll be right back with more on IBD and IBS.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935.
Cooper Wellness Center now offers a wide variety of vitamins and nutritional supplements. Omega-3 protection for the brain. Coenzyme Q for your health. Turmeric, the wonder supplement, great for joint pain. Vitamin D3 to promote healthy bones, plus many more multivitamins for women and men. Find these quality non-GMO supplements at great prices online or at Cooper Wellness Center. Live healthy, live smart.
Welcome back. You're in my kitchen today, and I have something very special for you. Now, my name is Dr. Cooper Dockery, and I like to emphasize plant-based whole food nutrition, because we know that can actually reduce your risk for chronic diseases. However, what can you eat that is sweet or unhealthy for you? So I have a guilt-free ice cream. Ice cream, I said, I am doing ice cream on the show today. I will be doing banana papaya ice cream. And for the recipe, you can find it in my cookbook, Incredibly Delicious Vegan. So what do you need for this recipe? Not much. You need a high-speed blender. You need some frozen banana, 4 cups of frozen banana cut in pieces, then 3 cups of ripe frozen papaya, 3 tablespoonfuls of non-dairy milk powder, and of course, about 1/2 cup to 3/4 cup of nut milk. So let's begin. This is actually very delicious. So we're going to place our frozen fruits here in the blender. And sometimes there might be a little bit of difficulty getting everything blended, but just be patient. It is actually delicious. So we're putting a ripe banana, frozen, and these bananas should be very ripe. And then we're going to add our milk. And this time I'm using almond milk. So I'm going to add this. I'm going to blend that, and at the end, I put the milk powder. So let's see what happened here. All right, let's see if this thing works. All right, we are going to start. Okay. All right, we're going to blend this. Okay, hold on. Okay, got it. Now you can stop and check. You might need to give it a little spin. So I'm going to get a spoon and we're going to spin this around. All right. And we need to continue to blend this until we get it the way we want it. So let me push this down and we're going to blend again. It's really delicious. You know, my kids love ice cream, and when I make this, they don't know what it is. All right. So let's blend this again. Very delicious. Okay. All right, so it is done. I'm going to serve the ice cream. Let's take this off, get back here in the middle. And this is actually fantastic. Let's try. You put a scoop in here. You can have this with some nice, delicious vegan cake. This is my final product. I'm going to be doing 2. All right, this is really good. So if you want to eat something healthy but sweet, guilt-free, no cholesterol, no sugar, this is the way to go. You can keep this in the refrigerator, harden it up somewhat, and you're ready to go. This is our vegan ice cream. Very, very delicious. So for more recipe, don't hesitate to go to my website, drdonnacooper.com. I'm going to taste this before I get off the air because I know this is fantastic. Try this at home. drdonnacooper.com, that's my website. Hi, meet Sarah, a normal girl like you. But Sarah had a big problem. Sarah was overweight and thus increased her risk of dying young. But luckily for Sarah, she discovered Dr. Cooper's complete weight loss solution, and now the problem is gone. In this solution, there's a set of DVDs, 40 cooking videos, exercise DVDs with exercise band, Dr. Cooper's book 14 Days to Amazing Health with over 100 delicious recipes and helpful tips. What are you listening to me for? Listen to what they have to say.
I was able to lose 20 pounds, I didn't want to, which helped me to drop my high blood pressure medication. My mother lost 50 pounds and no longer takes diabetic medicine through the program.
And I've learned a lot. I've learned that I can prevent any disease by having a healthy lifestyle. I lost 8 pounds, yes.
I came to Dr. Cooper. I had diabetes. Within maybe 2 months, I was doing better. I'm off my medication. I continue to do exercise and follow a diet. Follow Dr. Cooper's directions, and everything will be okay.
For only $79, we'll send this complete kit to you. Go to my website, drdonnacooper.com, or call 1-844-343-8935. Well, we have come to the end of our show, and I'm sure you have learned now the difference between IBD and IBS. Do you find yourself with one of these diseases? If you found yourself with any of these symptoms, then you need to see your nearest doctor. However, I would like to let you know that I'm here to bring you hope. In my books, you can see here 14 Days to Amazing Health, Get Healthy for Life, and Incredibly Delicious Vegan, you will find information not only on food and nutrition, but on exercise, meditation, trust in God. All these are important factors to help you attain good health. You know, the Lord wants you to be healthy. He wants you to have long life. So today, I want you to pray and meditate. Find yourself the nearest faith community, because studies have shown that people who have faith, people who have a faith community, tend to live 7 to 10 years longer. So if you're seeking health, remember to ask your Heavenly Father for help. Find me at my website, drdonnacooper.com, or on any social media platform. Follow me and learn how you can use simple lifestyle modification to attain good health. Go to my website and click on the link to one of these books, and I can assure you that you will find amazing health and happiness by acquiring this book. As I leave you today, I want you to follow me every weekday on this same station, and ask your friend also to come along. Until next time, I'll see you. Bye-bye.
This broadcast was sponsored by Cooper Wellness Center and Faithful Path International Ministries. For more information on how to become a patient or a sponsor, please contact us at 1-844-343-8935 or visit our website at drdonnacooper.com.